In this video, we'll be going over the lower eyelid procedure, also called the lower blepharoplasty with orbital fat transfer, which is a very long way of saying Dr. Standifer will make an incision under the lash line. He'll address that extra skin and extra fat, but instead of throwing that fat away, he's going to reposition it further down on the cheek where we tend to hollow with age. As with all of our procedures, you will get a copy of all of your aftercare instructions with your appointment dates and times. And as always, ice, ice, ice. Ice is very important the first 3 to 4 days. The first night, your caretaker is going to be responsible for changing your ice out about every 2 hours, so kind of warn them about that. The next day, we can switch to more of a 20 minutes on, 40 minutes off process. With the lower eyes, we will give you a frozen eyelid mask that you can refreeze in the freezer. You will need something to use while that's freezing though. So I always recommend to get a big bowl of ice water, set it beside your bed or your recliner, put a bunch of washcloths and soak them in there. That way you can pull one out, wring it out, lay it down. When that one warms up, switch to another one and just repeat the process. Whatever you want to use is fine. We just want to make sure that we don't put ice or frozen plastic directly on the skin because that can damage those fragile tissues. We are also going to sleep elevated until the swelling is gone. So head above the heart. That allows gravity to do its job and pull that swelling downward. If you're flat, that swelling is going to stay right where it is. I tell people to plan on about 2 weeks of this, but everybody's different, so it could be longer than that. The lower eyelid skin is the thinnest skin of the whole body. So that means it does not take much for that area to really swell. Just like if you got punched, immediately swells. Same concept. That swelling is also heavy. It's heavier than those tiny little muscles are used to. So it is going to pull the lid away from the eyeball. That's normal, we expect it. But what that means is the eyes are going to tend to get dry because the lid is not right up against that eyeball when you blink, keeping your own natural tears in. So we will send you home with some artificial tears that you can use around the clock. We will also give you a nighttime eye ointment to put in before you go to bed, and that keeps you from having to put drops in all night long. You will also have a prescription eye drop, which is a combination of a steroid, antibiotic eye drop, and you use that 4 times a day. We will also send you home with everything you need to care for your incisions. We will give you sterile water, sterile gauze, Q-tips, ointment, eye drops, all kinds of things. You don't need any of those things until we see you the following day. We will go through everything with you the first time. If you are just doing your lower eyelids, you can eat whatever is tolerable for you, but do avoid excess salt. Salt makes swelling worse, so be mindful of those canned soups and processed foods. You may want to get the low sodium kind. You can shower anytime after we see you at your first follow-up. Just make sure you feel up to it, you can see clearly, you're not dizzy or lightheaded, but it is okay to get your face wet. It's okay to wash your hair. It's okay to gently wash your face. You won't hurt anything. Some things that are normal. People tend to feel worse before they get better. That usually happens around day 4 and 5. Some of it is you may feel physically worse with more swelling, more bruising, or just dragging, but a lot of it is emotional. You're going to say, why did I do this? This is not what I expected. I look terrible. I'm not getting any better. These are very, very common feelings. I always tell people we have to trust the body is healing even if we can't see it. I also say, don't check the mirror every hour and expect to see changes. There won't be any. This is a day-by-day, week-by-week process. Mild swelling and bruising lasting over 2 weeks, that's normal. But at that point, you can wear makeup, eyeglasses. There's things you can do to camouflage any residual healing. With the eyelid procedure, I always tell people to get some activities that don't require staring at a screen for 8 hours. So not staring at the phone or Netflix or your computer, because your eyes are going to be fatigued. They're healing, they're going through a lot. So I always recommend audiobooks, podcasts, music. Get some things you can do while your eyes are resting. If you're having multiple procedures around the eyes, like also the upper eyes or the brow, don't be surprised if you can't even open your eyes the next day because of the swelling. That is common. Some things not to do: no exercise for 2 weeks. We don't want to increase the heart rate or the blood pressure. You can do light walking, light chores around the house, but nothing strenuous for 2 weeks. And of course, if you have any signs of infection, like something is really red, feels hot, you have pus or a fever, call us. I tell people the easiest way to prevent infection is common sense. Wash your hands frequently. Use clean towels, clean linens. If everything's nice and clean, we're going to significantly reduce that risk of infection. That's all for this video. Remember, we will give you copies of everything. You will have the opportunity to ask questions, and you can always watch this video again if you need to. See you soon.